Okay, so good afternoon, everybody. I think I know the most people in the room, but if I haven't met you before, my name is Andy Williams. I'm in Leeds. We've got a blue sky and some sunshine going on, which is absolutely lovely. And with Hayley sort of starting us off earlier on, I feel like very attached to the countryside right now. So I was just thinking about Victoria Baskerville there in East London with the beautiful green rolling hills underneath the dual carriageways. Watch it, Williams. um, we seem to have quite a long chunk for this workshop this afternoon, don't we? Theoretically, we go through till 5:30. My intention is that we put some really decent breaks into that. We'll have at least 3 breaks during the time, and they'll be of one of them will be of significant time, and the others will be fairly chunky as well. Otherwise, we're going to get exhausted, aren't we? So what I'd like to do is we will be working off a PowerPoint, if that's okay. The PowerPoint I've tried to distribute, so it's well worth having, I think. You can get it on SlideShare. And probably the easiest way to find it is if you put in Andy Williams 28 as one word in the search criteria in SlideShare. It'll bring up various presentations that I've done. But also as I come in to do the SlideShare right now, share screen, we've got the link listed here as well. Okay. So I'd find it supportive if people could do me a thumbs up that you can see that link. Is that there for everyone? That's great. Thank you very much. So you might want to take a photo of that on your smart camera, smartphone. And again, if you go onto SlideShare and go hunting for, look, there's my username in the middle there, Andy Williams 28. If you just go hunting for that, then all the slides are there for you for later on. Okay. So let's just tip forward. So those of you who may not know me, I'm director of a registered training establishment up here in Yorkshire, the TA Training Organisation. And part of my identity, I think, is that I've spent many years in the NHS as a tertiary psychotherapist. And I mention that because it means I'm passionate really about the coalface of being a psychotherapist. I think there's something about the yes, the sort of the charge that we carry with the office that we hold. So there is something sort of spiritual almost in that responsibility that we carry, but there's also a really sort of pragmatic part to it as well, which I'm well aware of. And some of my colleagues here in the room will be working in maybe IAP services or very practical services, and we've got that combination, haven't we, of the idealized situation, but also having to get on sometimes with our earning our daily bread. And I'm very interested in that sort of relationship and arming and equipping people to be fully themselves in their own boots as therapists, but also not set up in some kind of way in terms of the service that you're working in. My research interests at the moment continue to be about the efficacy of supervision. That's really interesting me. I've just finished a master's in that and learned a lot really, and it's changed my practice as a supervisor, hopefully for the better, but the only way I'm going to be able to find out is by researching it all over again. So back to the beginning maybe. My writing interest at the moment, a colleague and I are writing a book at the moment called Suicidal Conversations. And it's a book of sort of reciprocity, really, that my colleague writes a piece and then I reply to her and then she replies to me. And we're going back through various experiences we've had in our practice of clients taking their own lives, or people left behind after that experience. And it's proving very, very interesting. I'm very interested in queerness and clients who identify as queer in all dimensions. I'm working with quite a few people who would identify as heterosexual but having queer gender identity, for example. So there's something really about that word being, I mean, I know it's been reclaimed for many years, but it's sort of re-emerging, it seems to me, in a new way yet again. There's something going on for me about culture and embodied culture. I've got the privilege of working with quite a few supervisees from different cultural backgrounds, and there's something about how we embody our culture. So I'm beginning to write an article about how, in my case, how I embody whiteness, and what does it mean to walk around in a white body. So sort of watch this space, because it's emergent, and if anyone's got any ideas or thoughts about that, you know, I'd be really grateful to receive them. It's really come through working with a Black female supervisee who has been really bringing her body to supervision all the time, saying, you know, I'm a Black female practitioner, and I'm in a Black body, and I cannot separate myself from my embodiment, not that I'd want to, but what does that mean? And we're looking very much about, you know, our two bodies, you know, my white body and her Black body in the same space, and what does that then mean for supervision? And then very interested in ancient pathways across the UK, and have a yearning towards EcoTA, and beginning to do some reading and writing around that. So there we are. That's me at the moment. So let's just look at a bit of safety this afternoon, make sure that we're keeping ourselves safe and in one piece. So confidentiality, usual things about protecting our colleagues and clients. If we can all take responsibility this afternoon for our own psychological state, so remaining grounded and in adult. This is a short training, isn't it? You know, short workshop for a couple of hours. So please don't disappear into deep therapeutic places. It's absolutely fine to pass and to miss an activity. There are no rosettes awarded, but please stay engaged with the process if you don't want to do a particular activity. See what learning you can get from that moment. Let's all remain ethical. So let's just be a bit attentive if you land up in a breakout room with your therapist or something like that, then do feel free to exit and be reassigned. And if we can share time equitably, please. So in groups, make points clearly and concisely, and let's be mindful of ourselves and also others around us. And it's absolutely fine to ask questions through chat. It's fine to interrupt if you want to as well. So please do unmute and pitch on in if it feels relevant, you know, and let's see what we can all co-construct as a teaching and learning environment this afternoon. I look forward to learning and teaching, and you know, you can please do the same. I've got a couple of things flashing in my here. Oh, it's chat. So let me just have a look and see what we've got going on. Oh, go on. There we are. Oh yeah, there's some lovely offers there. That's great. Fine, thank you. I'm just going to stop the share a minute and let's see who we've got in the room. I know that Karen Minikin was possibly going to join later on, but there's another couple of sort of heroes in the room that I just want to sort of say hello to really and point out. So we've got Victoria Baskerville in the space. Hi, Victoria. And oh, you're on mute at the moment.
Just testing, Andy. Andy, I'm not sure anybody's called me a hero before.
I'm sure they've called you lots of things, Victoria.
Oh, that's true.
This workshop is actually very important to me because it's a kind of culmination of some chunks of thinking over 2 or 3 years, and Victoria's been absolutely central to some of that thinking. And I think many of us are aware that Victoria's practice is modeling something within the TA community and beyond. So I really want to acknowledge you, Victoria, and sort of dedicate, the workshop to you in a sense. So I really appreciate your presence. I think Karen Minikin might be joining later on. So likewise, she's very important in this. And then we've got other folks in the room, haven't we? For example, like Neil. Hi, Neil, down over in Bristol. But I know Neil's been doing a lot of pioneering work in sort of non-neurotypical fields and things like that. And it may be true for all of us in the room. I really want you to feel attached at this moment and not feel, separated from. But the point I'm making is that we're all pushing forward on the boundary of difference, diversity, oppression, and privilege, and growing our practice and making, in my case, some heinous mistakes. But there we go. Life's an experiment. But I really, really appreciate my colleagues in the room, and there's Mo there, who's I've known as long as I've been a transaction analyst, and other senior members of the community, and for you, there's some old friends in the room for me, and also you might be brand new, and that's absolutely fine too. Welcome, and we've all got our seat here, haven't we? We've all paid the money, and we've all got a right to be here. So that's really good. So let me just go back onto screen share again. So if we're all okay with keeping ourselves in one piece today, which would be a good thing to do, where do we go next? So I recently was metaphorically up in Scotland at FISIS, and FISIS were having an all-together day, and Victoria was there, and maybe some of you as well. And I think it was Victoria's point about getting to know one another. And she was saying that, I'm not sure if the metaphor of an iceberg came from that or not, but it certainly has for me, about here we go with an iceberg, and we've all used the metaphor of an iceberg before in different ways, haven't we? That you can see a little bit of it out of the surface, but we know that the vast majority of it, the great weight of it, is under the water. And the way I'd like to think about that today is in terms of our transgenerational and our cultural story. Our transgenerational and our cultural story. And if it's okay to choose Mo, because I can see you in my column of people there. I know Mo a little bit, and I've sat next to her at dinners and things like that. But I don't know Mo in a really deep way. I don't know her transgenerational story, and I don't know her deep cultural story. And to know someone really well, I guess we need to know the bits of the iceberg underneath, don't we? So what I'd like us to do, stealing an activity from East London, is what we're going to do is just spend a very short time really in a small group. And the first thing is I'd invite you to bring a very safe example, but an imaginary or real cultural object as a way of introducing yourself. And this can be as small or as big as you like, of course, because it's in imagination. So if you're French and you want to bring the Eiffel Tower into the room, that's absolutely fine. Or you might want to bring a thimble. And then follow that introduction using a piece of your cultural narrative. Is discuss the following question with one another. Imagine being in the therapy room if you're a counselor or psychotherapist, or if you come from a different field, wherever that field would be. Imagine putting yourself in the heart of that field. And think about the question about, what are we doing here? What is my view, for example, on the purpose of therapy? What is the purpose of therapy? What am I doing in this space? Everybody okay with that as a starter? So I'm going to stop the share, inviting you to check in very safely with each other. So the first thing to do is to bring an imaginary cultural object to maybe show a little bit of that iceberg from underneath. And then secondly, think about the purpose of psychotherapy, if that's what your profession is. And what are we doing here? What is the purpose of psychotherapy? We're going to go into very small groups. If we go into threes, I think, and if we do, that will give us 5 minutes each. So just quarter of an hour to do that opening exercise. And I imagine some people might. Let's have a look. So we'll cymatically.
So Andy, Andy?
Yeah, sure, go for it.
You know what I loved about that image just now of the iceberg is you were talking earlier about working with your client in your white body.
Yeah.
And what really struck me is the iceberg being the white body.
Gosh.
And actually what happens often is we just project race.
Yes.
And actually, if we look at the cultural identities in more depth, in terms of intersectional identity that you're describing, privilege and oppression, then that puts a whole different lens on the cultural narrative, because what we can see each other right now is just in terms of race.
Right.
And in terms of constructed race and constructed gender. However, the moment we start to tell our cultural narrative, we get all those in that water underneath is the depth of our cultural narrative.
That's so helpful, Victoria. Thank you. So, keeping ourselves safe for this afternoon. Let's go into that. So I'll set up some breakout rooms. I think we need about 8 of them. So welcome back, everybody. We were looking at 2 things really. We were looking at that multifaceted part of self, as Victoria was talking about. You know, us as the oppressed and the oppressor. It may be in terms of the cultural, dissolving some of the cultural transference, but also beginning to introduce this idea about what do I individually truly think that psychotherapy is about. And I was in the main room with Joe, and we began to talk about sort of neoliberalism and all sorts of very interesting things. Where did you get to in your small groups? Maybe we could hear from a couple of people. That would be great. Be brave and go for it.
It went too quickly.
Yes.
And we didn't get nearly far enough. I think what is about finding intimacy.
Oh.
That and what we've been talking about this, when we talked about bias, and here I am, I'm a Southerner and I have a nice accent, unlike yours, Andy. But so I've got a nice accent, but for Fiona, who's from Macclesfield, when she hears my accent, she has a bit of a, oh, what's this? This isn't. And so and all of us have these biases. I was explaining how when I hear an American accent, I know that I'm going to get on with the person. And after 5 minutes, when it turns out that I'm not getting on with them, it's always because they're Canadian. So it seems I don't like Canadians, but I have an idea that I don't, that I have an idea that I like Americans. But it's when we're in the room that we can put away those biases and just be present, that I think we can connect. And it is intimacy that intimacy heals.
Okay, so I'm hearing a couple of things. You know, the cultural thing is very complex, isn't it? And in a sense, thank you for, you know, giving us a window into that world of yours. But I'm going to gather the bit which is about the intimacy. You know, that's the component that's important to you. Could I hear from somebody else where, you know, about that question then? If we are therapists, you know, what are we doing? What is therapy? What's it about?
We talked about meeting the other. You know, a lot of people go through life and they're not actually met. People don't pay a lot of attention to some people, or, you know, so it's about kind of stepping up and meeting the other in that space and purposefully connecting, which is, you know, backs up what Paul was saying about the intimacy.
Okay.
And really hearing rather than just listening. So, and I think that's where the healing comes from, when someone is paid attention and is met in that space.
Okay, lovely. Thank you for that. I want to go to Mo and then to Denise, and then we'll move on after that. Hello, Mo. You want to unmute, Mo? Otherwise, we're going to miss your words. There we go.
I'm just backtracking to what we were talking about. And I know that there was a sort of a general experience of being with another and meeting the person in the space. And I want Hilary to, I've lost the other lady. Where are you? Lucy. I want Hilary and Lucy to intersect if I've missed anything. And we talked a little bit about a book by someone. Hilary, who was it? The book?
Matthew Elton.
Matthew Elton.
Oh yes, yeah, Matthew Elton, yeah.
Yeah, who talks about meeting the preferred self or working with the preferred self, and I said I'd be really interested to talk to him about how that fits with the potential self, and you know, how you sit with the client to find out where their potential is rather than what you think it should be. So can you add anything to that, Hilary or Lucy?
I think I was quoting Matthew's book as saying it's about helping the client get closest to their preferred self.
Right.
Which, of course, they may have an idea when they start therapy about what that is, but that can change. And you were talking particularly, Mo, about learning every day in the encounter, both people learning, so change for both people in that partnership.
It's a co-creative thing.
It's so rich what you were both saying, and so helpful, and notice also the difference in the room, you know, that people are saying, in a sense, some quite different things, which I think is very, very exciting. Denise, can you round us off before we move on with the workshop?
Yeah, just very, very quickly, we were talking about safety and courage and empowerment.
Okay, thank you. Okay, so where this workshop is heading, and I was saying earlier on that it's sort of a place of passion for me, is there's something absolutely essential about us knowing who we are and our philosophical position. Now, obviously that's dynamic. We change and we grow, don't we? And I'm changing and growing as this workshop continues, and I'm hearing from people, you know, I'm shifting around internally, and you may well be as well. But at any sort of one moment, it's absolutely essential, I think, that we have an understanding of our philosophical self, or our sense of values and principles, and what's truly important to us, as practitioners. And so this is my passion about the content of this workshop, because I think what it does is it liberates us as practitioners. I think it frees us up to be fully ourselves in that moment. And it doesn't mean we're not going to change or grow up or become more mature, or, you know, something further down the line. So taking the theme that we've got to, let me just go back to screen share. And this was the group activity, wasn't it? And then if we move forward, so the late Robin Walford, who was one of my trainers in Leeds, sadly Robin died, I think last year, or maybe very late the year before actually. He used to say that the purpose of therapy for a client is having the experience of ultimate acceptance of self. That was his definition. You know, when I used to say to him, Robin, what on earth are we doing in this? I don't understand what we're doing here. That's what he'd say. I'd then say to him, well, what about Hannibal Lecter? Because do we really want Hannibal Lecter to ultimately accept himself? Do we hand him a set of cutlery so he can go and eat somebody else? And in that sense, I think I was missing the point, because it's more about existential okayness, isn't it? We're not going to say Hannibal's behavior is okay, but I guess him being able to ultimately accept even that part of him maybe is a really, really interesting idea. And then if we look at from a couple of other people, I've got a lot of time for Hannah Levinson's work. She wrote this book about time-limited and dynamic psychotherapy. Psychotherapy is about offering the client new information and a new relational experience. And you don't have to agree with any of these. Please don't feel that, you know, this is an afternoon of openness and critique. So please feel confident to remain in your own boots. I don't know, I never quite know what I think about this one, you know, because again, what she's beginning to echo for me is, you know, that this relational experience is going to be reparative. But I think those of us who work in a true Martha Stark two-person way get very suspicious really about the nature of the relational experience. You know, it's not all beautiful blue sea, is it? Sometimes the waters are extremely rough and choppy, and necessarily so. You know, we become more and more mature about rupture and reenactment and the nature of that. So when Hannah Levinson here says a new relational experience, it might be a benign comment, like, you know, that the therapist is still there after the rupture, whereas maybe in childhood that wasn't the case. You know, that would be a benign example, wouldn't it, of a new helpful relational experience. But to me, it begins to echo a little bit about that sort of dangerous area that we can get into as therapists, which is, you know, this time we're going to do it better. You know, you had a shit childhood and then your last 3 therapists haven't quite got there, but me, I'm going to be superhero. I'm going to wear my pants outside of my tights. I'm not going to get caught in the same transferential disasters that the other 3 therapists that you've had, and this time you're going to have a new relational experience that's going to work. And of course, we're not that naive. Well, sometimes I can be, to be honest. Sometimes I can. But so I think this is an interesting quote. In a sense, the last person I want to quote is Eric Berne. I'm not even sure if this is accurate. You know, I was getting it through various other places, but you know, this idea about we're here to put a new show on the road. I think the trouble with quoting Eric Berne is that his theories are so developmental, aren't they? You know, he was cut short, and I don't think we ever saw the seminal thinking of where he really got to. And so I think I often think it's quite unfair in a strange way to quote Eric Berne, because we know that he wasn't the finished product at any one point. But you know, that's an interesting idea, isn't it? You know, about that therapy is about putting a new show on the road, and this idea of maybe the pathology that would have been indicated about script in early thinkings about life script. So what, you know, let's cut to a sort of so what. So what are you saying, Andy? What I'm saying is that I would like to encourage each one of us to developmentally, wherever we are at the moment in our professional careers, to be able to begin to formulate an answer that satisfies us, because that is going to help us to know who we are, and we need to know who we are. And we'll talk more about why that is in a second. Even the question, you know, when I was posing the question about what are we doing here, you know, the here is very debatable as well, isn't it? You know, the space, what kind of space is it? You know, is it a teaching and learning space, therapy? Is it a lounge? Is it a relational space? I mean, I suppose a lot of us, you know, historically, if we think about it, it's been a bedroom, hasn't it, for many years, maybe with early psychoanalytic work. But, you know, Martha Stark, I think, would argue, you know, that the space even changes its nature. If we're doing one person work, is it the same kind of space? 1.5 person, as, you know, beginning to use words like the intersubjective space. And not every place where we do counseling or therapy, I guess, is actually an intersubjective space. That intersubjectivity may or may not be present, or may be fluid. You know, it might be present at some times and not at others. So even defining, you know, the therapy space, and then good old Haley and Giles come along and throw a big rock in it and go, you know, well, actually the space doesn't even have walls. Very helpful of them, I must say. So, you know, I just want to raise that as well. So it's not only what are we doing, but what are we doing here? So we need to think about what's the doing and what's the here, and where am I today in April with my thinking about that as an individual practitioner. Let me just see where I am on my slides and whether it's time for a break after this slide. Yes, we will do that. So this is the last slide, and then we'll have a breather. So I'm being slightly exaggerating here, so be kind, but I thought just to really introduce the idea really about our thinking about, are we talking about syntonic experiences or dystonic experiences? I think the reality actually as grown-up therapists probably is that we're offering both, and that we're moving in a dynamic fluid model. But I think it's an interesting idea. How many of you, I wonder, have been to supervision and talked to your supervisors about a rupture that's happened? I know I've done this, and my supervisor has rubbed their hands together and said, you know, this is wonderful. This is a wonderful therapeutic opportunity. How fantastic that this rupture's happened. Meanwhile, I know that this client is actually really pissed off with me, has no understanding that there's any value in this at all. And actually they see it as a failure of the 5-star hotel experience. You know, that the cushions have not been plumped, and that the tea was not hot, or, you know, too hot or too cold, and that Andy Williams has cocked up. They don't see it as a relational opportunity. And so I think this is something that we really need to think about how do we socialize our clients, maybe to more of the right-hand column, you know, which is about dissonance. What have we got there? You know, that congruity in the true sense of the word, you know, that there is a degree of openness and honesty going on, awareness of unhelpful processes, and that therapy is, you know, if we think more about Ray Little's work about the reparative or the required relationship, you know, that we're looking at something that's more required. So relational disturbance is seen through a reenactment lens, you know, and it's an essential experience. It's absolutely required and needed. And so therapy becomes a place of curiosity, creativity, and disturbance. And I think if we can have partnership on the right-hand column, you know, if you've got you and your client, sorry, me and my client, and we have this third object that we're looking at, which might be the therapeutic relationship or the work that we're doing, this works very well, doesn't it? But sometimes I think we can get moved over onto that left-hand column, where it's about empathy and unconditional positive regard. And we may get stuck at this idea of just a reparative or restorative experience. Relational disturbance is an unfortunate rupture. It's seen as a failure. And you know, I think sometimes we set ourselves up, don't we, with our websites, with waterfalls and beautiful rocks and stones and fossils and green trees and things. And actually, maybe we need to have a few more other images on our websites, you know, of drawing pins and hammers and hacksaws, you know, and things that indicate rupture as well as serenity. I'm going to stop sharing. We'll have a break in literally a couple of moments. How are people doing? How's energy? How are we with this material? Yeah?
Yeah.
Okay. So, yes, lovely. Yes. Some Hagen and Sill stuff is there. And thank you for the contact. So what I'm really wanting to lay out here is this is not the gospel according to Andy Williams, but I'm really encouraging you to go back again into your own archives of self and to check in on yourself about your beliefs about our activities, really. And the argument I'm going to bring is that it's important that we know, and I know we'll support that anyway, but we'll talk about that using some TA models. Okay, I make it 3:30. Why don't we have a 10-minuter? And there'll be other breaks as well, but let's have 10 minutes break and movement, and then we'll come back. Yeah, Mo.
Is it okay if I just say what I was thinking about that developmental bits?
Yes, please, that'd be lovely.
When you talked about Robin.
Yes.
Yes, his quote, the purpose of for a client is having the experience of ultimate acceptance of self. And then you talked about Hannibal Lecter.
Yeah.
And I thought, yeah, I absolutely get that. I usually use, yeah, never mind, Nazis. As an
yes, sure.
But in actual fact, that experience of ultimate acceptance of self is a developmental necessity in the first, pre-birth and as you're born, is to experience that ultimate acceptance.
Yes.
And the other thing is that the Hannah Levison stuff, when Burns said, it's Burns, to put a new show on the road, I immediately thought of the developmentally as the young adult. But that's it's not a complete picture, because I don't know whether you remember this, it must have been 10 or 15 years ago, I did a workshop called The Job of the Adolescent is Not Only to Kick the Parent Off the Pedestal, but into the gutter in order to put their own show on the road, and at some point in the future, come back and meet them as real people for the first time.
Yes. Yeah.
So the reason I just wanted to say about that is because I think these are all correct. These are all, it's possibilities, isn't it?
I love that. And I think, yes, there's a real maturity about how you're bringing that, Mo, isn't it? Like an idiosyncratic, bespoke, personalized way of thinking about it for every client as we go. The function changes as we go as well.
Yeah. And of course, at the time I did that workshop, I was working with young people in care.
Yes.
Who were in trouble with the law and everything. So
do you know what? I do remember that workshop. I can't remember. It might have been Keele, but I can't remember.
Could have been.
Yeah.
I was just thinking more about, of course, Levin and that in terms of development and the recycling.
Yes.
And going back through those stages and re-meeting the adolescent in ourselves. And I love that.
Multiple possibilities.
It reminds me, Victoria, of what you were saying about sort of the matrices, like we deal with very, very complex systemic networks, don't we, all the time, even in the individual, like we're moving back and forward through developmental time. Or I was thinking about the idea that, we are the oppressed and the oppressor, these multiple identities at any one time. It's a very complex narrative that we traverse, really.
And I was just thinking what you've just said, Andy, and what Mo was saying, that there's something about we also need to be willing to be got rid of, to be put into the gutter.
Yes.
Yes.
So there's something about, I was thinking, I don't want to go too off, so I'll just keep it short, but something about kind of within even the TA organisation, where the kind of elders sit, and this hierarchy we have, there's something about people need to be willing to be thrown into the gutter. Do you know what I mean? Got rid of, really. I mean, not permanently, but that movement between oppression and oppressed.
Yes.
I think if the structure stays fixed, there's no room for the new development.
Absolutely. And of course, the added bit to that would be the job of the parent in that dynamic is to take back their self-interest. So it's like, instead of being the parental figure or devoting yourself to the child, or the, you know, how do we let go when they're grown up enough? Yeah. Is about the parent taking back a self-interest. Allows the separation. Anyway, that's another.
Thank you both. That was lovely. Okay, so welcome back after our 10-minute break. We were going to do some more small group work during the afternoon, but I think because of technically where we are, I might really we might work in the whole group, and we're not hugely huge, are we, this afternoon? And hopefully we're getting to get to know each other a little bit. So I think that might work better for us, but we'll see how we do. Okie doke. So let's continue the story. Right. So I think there's something to just think about for any purists in the room, you know, that when we use the word philosophy in this kind of context, I don't think we're truly talking about philosophy. I think we need to let ourselves off the hook here a little bit about it. We're going to come to a model that Keith Tudor wrote about in when was it? 2009. It's about 10 years plus ago. And under philosophy, he's kind of including the idea of principles, motivations, attitudes, values, that kind of idea. And I think under our philosophy, we can also think about ideas of what's important to us transgenerationally, or what's culturally important, you know, what's in our DNA almost of experience. And we could start thinking about our thinking styles as well, and our neurology. Dave Ward has got a little book that's called Philosophy for Everybody, and he talks about the definition of philosophy being an activity. He's very, very keen that philosophy is seen as an activity of working out the right way to think about things. I think we as transactional analysts would be very suspicious of that definition, because it sort of implies binary right and wrong. But what I might encourage us to think about is an activity of working out the right way to think about things for ourselves at this moment in time. But I think we can take the idea of an activity. I think that's useful. And you know, there's various critiques about it. So the point I'm raising is that we're going to be using the word philosophy in a very broad term, and I hope that doesn't offend any true degree or master's philosophers in the room, you know, because I think we'll be stepping out a little beyond the standard definition. So there's an article by Keith Tudor from 2009, and it's called In the Manner of, and it's all about how we teach TA and whether we teach TA within the philosophy of TA. And I take great delight in using articles that are non-psychotherapy and moving them into the psychotherapeutic field. I think work by Giles Barrow is brilliant for this as well. You know, have a look at Giles's stuff about education, because boy, does it move across into psychotherapy beautifully, especially ideas like encounter, for example. But this will be a model that's very familiar to people who work with me. But what I'd like to do is to nick it. I'd like us to steal his educational model and think about it as being a psychotherapist. And straight away, I'd encourage your critique flashing light to come on as well. How are you going to make this yours? How are you going to make this yours? So what he talks about is the interrelationship between practice, theory, and philosophy. And I think this is an absolutely brilliant idea. because what it does is for me, it really settles myself, and it brings me to this middle place here of a potential place of integration. So what he's arguing is that we come from a place of our own personal philosophy. We've all got different philosophical stances in the room. And that, I believe, actually comes from our cultural and transgenerational history. I'm sure there's other reasons where our philosophy comes from, our life experience as well. But we land up, don't we, with things that are important to us. And there are people in this room where, you know, maybe all of us, but people who write and talk about things that are terribly important to them. But what the point of this is that out of our philosophical stance, we then select things. We then select the theory that appeals to us, and then we leak and we practice. And so there's an interrelationship between our practice, our theory, and our philosophy. And in the middle of that is an area of hopefully integration. And then again, I'm sort of looking at Victoria in the room as well, you know, because what's absolutely vital is thinking about the socio and cultural context in which we work and how we think about how that, I'm not sure if it does surround or if it occupies, you know, models are very static, aren't they? What I'd like to do, which is a bit awkward, is I just want to get a flip chart actually, which is just off to my right, and talk about this model a second. Hopefully you can all see that, and you can always pin me if you want to. What I'm just going to do is just draw a line where I'm at. So it's sort of there-ish, isn't it? Right. Okay. I want to talk about an example linked to this model. Okay. So if I draw my 3 circles, and we think about philosophy, we think about theory, and we think about practice. And the idea we're thinking about is that there's a place of integration there, which can sort of describe a settled place in myself as a practitioner. We might begin to start thinking about the word subjectivity, actually, that maybe that's my subjective identity in there as a psychotherapist. A place of return, a place of home. So that when I land up in some kind of intersubjective rough seas with my clinical work, which, you know, happens fairly frequently and can be very uncomfortable, can't it? You know, I go home and my kids are there eating their, whatever they're eating, and I'm trying to attach and engage around the dinner table in the evening. But I find it really hard because I'm feeling very disturbed maybe by what's happened in the therapy room earlier that day, actually. So the example I wanted to talk about was CBT. And to talk to you about that, and I want to be really, really clear. I think CBT can be a beautiful model, actually. It can be very idiosyncratic, it can be beautifully personalized and things like that. And I know some of my colleagues in the room here might well work with CBT and things like that. So I want to be respectful, but also I'm just talking about me, okay, as an example. So I'm an accredited CBT therapist, okay? So my theory is really quite good with CBT. So I can occupy that theoretical space with quite a lot of confidence. I even deliver some courses on CBT. And I'm able to practice with CBT. I know what I'm doing. So in fact, if we look at this would sort of occupy this Venn diagram here. Can everyone see why I'm coloring that in? Because what I can do is I can say, I feel I'm good at CBT theory and I'm good at applying it to practice. So I'm pretty confident on that those arenas. The trouble I have is that I trained in CBT. I did it deliberately because I wanted a job in the NHS. And I thought the way to do it would be to get a CBT qualification and I could commit murder behind closed therapy doors. And actually it worked brilliantly. Nobody kind of asked what was going on once the door was closed. So they employed me as a CBT therapist, and then, you know, all's fair in love and war, that's what I say. But the problem is that I can't subscribe to this. I try really hard, and you know, the philosophy of CBT I've reread, and I've talked to colleagues, but the way I was taught it contains some kind of, for me, some kind of hidden violence. And I'm really up to being, you know, confronted on this, but I'm just talking about my personal experience. There was something, I don't know what the transactions are, but it's something like an okayness and a not okayness. And I think there was a lack of attention to the vulnerability of the client in the socio-cultural context. You know, so like clients were I'm being sort of a bit confidential about where I trained, but, you know, clients were sort of dragged in from their poverty and their desperateness, really, and expected to combine to come up with an agenda and to be able to work through and to go and do their stuff, and, you know, et cetera, et cetera. And it was everything looked fine, but there's just something, and I'm still not there now, 10 years later, being able to really identify what it is for me. And I go to lots. I went to a really good CBT training online last week, and the people were lovely, and the work was great, and it was about imagery and trauma, and it was fantastic. But there's still something that I can't philosophically sign up to. And so what that means is that when I'm practicing the CBT, I don't feel ever comfortable. I can do it, my theory's all right, and I can convert it to practice, but I can't sit for some reason in this central place. And that's just an example, and you may have examples of that in different ways too. And I'm really open to a CBT therapist pinning me in a corner at some stage. Maybe my supervisor needs to do that, my CBT supervisor. But that's the example that I'm offering you, because I think what we're looking at, aren't we, is a congruity between these three areas, between the philosophical position that informs the theory that then appeals to us that we would choose, and then how we apply that in practice. And that, to me, is a highly integrated practitioner. And again, the bit that I've missed off, which I need to put back on there again, isn't it, is within a political, social, cultural context, that we do this within a context. Okay, I feel like I've rather sort of lectured at you, so why don't we open the floor and let's hear some, you know, some what's going on in your heart, maybe, or, you know, what's running through your mind. Let's do a good old CBT intervention. What's running through your mind right now?
I just want to say that really resonated with me. I'm actually considering applying for a high intensity CBT, and that was my feeling. Yeah. And I just thought, because I'm a CAMHS practitioner at the moment, and I'm I want to use TA, but I work for CAMHS.
Yes.
And my colleagues might believe that actually that works really well with clients, and so do I, but it's not an evidence-based. It's not, they don't want it. They don't want it. So CBT is the way forward. So I just wanted to put that forward and just thank you for that discussion, because it's going to help me decide actually whether I complete that application. Well, but yeah, and it's a difficult one, isn't it?
Well, a bit like I said at check-in, Caroline, you know, I believe in the pragmatic as well. So, you know, in order to be protective and pragmatic, maybe that's, you know, the thing to have. And, you know, and it's very useful, isn't it? There's so many, you know, and the other thing that's very exciting is, you know, that CBT today is not the CBT I learned 10 years ago. You know, there's this huge energy about imagery at the moment. You know, it's images everywhere, and that's really exciting. That feels a lot more fluid and humanistic, actually. So, you know, the CBT amoeba is still rolling forward, and it's like something from Star Trek. What was it called? Was it the Borg that used to assimilate everything? But in a really good way. If we're lucky and wait long enough, maybe they'll find TA.
But it has a place. It does have a place. I see that, absolutely. But
and you know,
but yeah, and I think that's the thing. I need to believe in something in order to.
And TA actually is a great cognitive behavioural model as well, isn't it? It's got a real strength.
You can use those bits in there. I like there's sometimes though I do like to go a little bit deeper, but you know, and I think the client brings a lot in with them, and I think as well, because I take referrals for the North Lincolnshire area, I do see a lot coming back in that have had a 12-week programme, but we've not really dealt with the systemic issues that are causing the difficulty.
Okay, thank you, Caroline. So, you know, I do want to be really careful, and I want to be very respectful. And I do think, you know, this is probably still some contaminated thinking on my part, but anyway, I need to go away and sort that out. But this is what I'd be really encouraging us to think about, you know, like, can we feel confident in those 3 arenas for ourselves, and that way feel that we have a place of return. Now, if I go back to Keith Tudor's article.
So Andy, can I come in just to say something about the model first?
Yeah, go for it.
I just kind of, I don't know if you can see that, but basically, do you see
Victoria?
I'll tell you what, I'll explain it. In terms of deconstructing the model that you've just taught.
I've just pinned you, Victoria, so we can see it, yeah.
Okay. The way that I would change it in that, and I think it's easier to explain, is that I would have the social and the political context in the middle, where he's put the integration.
Okay.
So with arrows coming out, so that the heart of it is the social and the cultural context of philosophy, theory, and practice. And then in that outer circle, there would be an outer circle that would be the influence of systemic oppression. And then the integration would be a circle around the inner 3 circles. So I think that, because I don't think we can really draw on philosophy, theory, or practice without it being within the social and the political and cultural context, in relationship to the wider systemic oppression structure. So basically, the way I've done it is lots of the central bit is the veins of it, you know, is the social political, it's in the veins. That outer circle is the integration, if we're accounting for the theory, the political, and the practice in a, you know, a whole way. And then the outer circle is the systemic oppression. But there's arrows going in and out. Do you know what I mean? It's kind of dynamic.
Mm. It's also got like a tension in it, hasn't it, on those that outer interface.
I think so, and I think that what you're describing and is, I think how often the philosophy doesn't meet, it isn't intersectional, or it doesn't. The reason that, you know, it's like the person isn't the center, really, the unique person, particularly, I guess, in places like IAPT, where it has been based on what's the most effective therapy, say, that the most cost effective, I mean. Yeah. But what I did want to say to you, Andy, is I know that you say that maybe you've got some contamination, and of course we all have, but you're probably one of the most inclusive people I've ever known.
Oh, thank you.
Just in the way that you honour all the different ways, I think, you know.
Okay, thank you.
Thank you.
Victoria, it'd be lovely if you could take a photo of that and send it to WhatsApp, and then I'll put it on a slide on the slide share. That would be great.
I scribble.
Yes, please. We like scribbles though, because they're organic and new. Yeah.
Okay.
So we'll make sure that we share that with everybody. Okay, I'm going to roll forward. We're at 4 o'clock and time's moving forward. So I'm going back to screen share, and we're talking about an article by Keith Tudor, aren't we? So this is Keith Tudor's kind of thinking, that he divided the idea about practice, theory, and philosophy, and this is kind of how he began to describe it. And then it was really talking about the centrality. I mean, it's interesting, isn't it? So another example of what he was talking about, that all practice is founded on an underlying philosophy in which the practice is rooted and from which the theory follows. And I think you and I could spend a really happy day talking about carts and horses and which way round that, you know, whether or not that statement is true or not. And again, I'd really encourage us to maintain your critique and have a think and see whether you, you know, I think the question of where does theory emerge from is absolutely fascinating, isn't it? You know, we're really getting into, I've forgotten the word, sorry, of it's not epistemology, is it? It would be ontological thinking about, you know, how do we know what we know? And you know, the political and social nature of theory, of course, and how does that emerge at certain times in history and things like that. So, but one of the things that is maybe less contentious is what Keith Tudor was talking about in terms of consistency and coherence. Consistency and coherence. So the consistency between theory, concepts, methods, and practice, a clear coherence between theory and practice. Can you hear that? I've just set Siri started. No, I wouldn't, thank you. Philosophical congruity between the philosophy, theory, and practice. So everything connects, and there's potential for a congruent, reflexive, and dynamic interrelationship between these components. So that's all very well, Keith Tudor talking about that maybe from a sort of theoretical model, but the point I'm making here is that I would wish for us, you know, I'd want to bless you and me in a way, with that dynamic energy right in our hearts and our minds, that we are able to integrate theory, practice, and philosophy, practice, and theory, almost like three stepping stones in the middle of a pond or a river. And there's Mo and me sort of dancing around from one to the other with agility and dynamism, feeling really comfortable because we know that we're going to be landing in a place that feels really at home. How are people doing with this kind of idea? And so, I mean, what it does do is it gives us some permission, doesn't it, as well, to not do some things. So, for example, there may well be theories that don't sit with you. They don't sit with your philosophical stance. I know I've certainly got some in TA. I'm not going to come out with them now. But also practice, you know, really looking at practice and thinking about, you know, why does this not sit with me? Is it to do with the theory? Is it to do with how it fits with my philosophy, my way of thinking? And having that maturity to be consistent and developing our philosophical stance so that we are supporting ourselves. Okie doke. So let's try this and see what happens. So in a moment, I'm going to invite you into a space. We'll talk about how we're going to do that in a minute, to find your philosophy again, to remind you. In my experience, this is often based on cultural and transgenerational history. I'm going to invite you to drop everything on the floor. So drop your role, job titles, family positions, typo there, sorry. But anything that you sort of want to cling on to, just for a few minutes, let it drop on the floor and really ask yourself this question about what is really important to you, truly. And why? Why is that important to you? Dig or drill deeper to see if you can get closer to the true meaning and importance of something for you. You may come up with a single word or perhaps a phrase about what is really at the heart of your therapeutic identity. Let me give you an example. Some of you know me well, so you'll have heard this before, but my philosophy, you know, is about emancipation and freedom. And it's about sort of minimum interference in order to liberate people to be fully themselves. And this image here, which I was shocked to find the other day because I'd not seen it before, this is my mother here on the kinder train about to leave Nazi-occupied Vienna. And this is her father. And it was seen as a sort of grand day out. And you can see these other kids on this train. And my mum was born in 27 in Vienna. The Nazis marched into Austria in 38, and my mum was 11 years old. And you know, to cut a long story short, she fled to England, and there's a whole narrative in there, and there's a sort of transgenerational trauma and sadness that I still can't necessarily reconcile in myself. So the point I'm making is that if I go back to that, I realize that my motivation for being a psychotherapist, I think, is from all of that material. I think my philosophy extends from that kind of place about emancipation and freedom. And as a trainer and as a supervisor, that's how I work. I want to see people emancipated and freed up. Now, that may appeal to you, or you may be horrified by it. You might sit and go, that's not why I'm a bloody therapist. I'm a therapist because of this. And that's absolutely fine. It's about you finding your home, isn't it? So let me just tip on the next slide. Oh dear. Sorry, I'm having a few technicals here. So I think this is so important to the workshop that I do think we need to give this a go. I'm just a bit loath to use that the breakouts, but I think we'll risk it. So let me just check in the room. Would you be willing to have a go at this in small groups? Would it be of interest? Okay. We're not going to be able to give it the proper attention that we need to, but why don't we give ourselves 10 minutes in a small group just to begin the process? And it might be something that you want to continue in the coming days. So we're going to go for the same breakout rooms, and we'll literally go for 10 minutes. And it may be that you just pick one person to have a look at this, or you might be able to share a little bit of time. So I'm going to open the rooms, and let me just have a look. We'll do 10 minutes in this space. Do you know what? We're going to do 15. It's worth it, isn't it? So 15 minutes, I'll open all the rooms and drop everything on the floor, all your files and your folders on your knees, metaphorically, anything like that, anything you've known before, and ask the question anew about what's really important to me and where's that come from. Okay. If you'd like to click to join if you want to, obviously you don't have to. Got a few more of the gang.
Really enjoying this, Andy.
Oh, thank you, Mo. That's lovely. You know what it's like.
Very special.
Yeah.
Thank you. Impactful. I really appreciate the feedback. You know what it's like. It can be a bit sort of out into nowhere, can't it? So thank you.
Silence is deafening sometimes, isn't it?
Yes, especially if you go to things where everyone is put on mute. You know, we've all been to webinars and things where you're sort of shut up. It's really quite disturbing.
Yeah.
Okay, I'm really mindful of energy and what's reasonable and those sorts of things. So I suggest that we do no more than half an hour together now. So 20 minutes will be 5 o'clock, and it'll be 10 minutes after that. So we'll be finishing at 5:10 on the dot, maybe with a little bit of mutual strokes after that. But you know, we'll be finishing at 5:10. Let's see where we've got to. I invited us to make contact at the beginning, thinking about a cultural icon and what we think psychotherapy might be about. And the reason we did that was we were beginning to get into a sense of self, of what is my story and what's my narrative and what am I bringing into this. And after moving around a little bit, we went into Keith Tudor's model, didn't we, which talks about these 3 arenas. My philosophy in the broader sense, whatever that means, maybe it's even identity, my identity, philosophy, values, and how does that inform the theory that speaks to me? And how does that then inform me as a practitioner in whatever kind of space that I work in? And that's a very profound question today, partly because of Martha Stark type work, but also partly because of Hayley and you know, where are my edges? And then what I've invited us to do is to spend a ridiculously short amount of time, unfortunately, I'm sorry about that, but beginning to go back again, you know, keep it simple, stupid, you know, let's go back and ask ourselves, what is my philosophy? What's really important to me? Not what I think ought to be, or, you know, whatever my training place is or my structure says that it ought to be, but what really, really speaks to me, because we know that that's going to be our energetic place. That's going to be where our physis and our life is going to be. Whereas the other stuff is always going to involve a tearing, I think, or a ripping or a tension of some sort. So without us all going tsunamiing, it'd be great to hear from 2 or 3 people about just where that may have got you. And then we'll carry on with the last bit of the workshop this afternoon. So where do people get with that? Did anything emerge for anybody? Give us a wave if you'd like to speak. So you've got Neil, and then we'll go to Liz and then Nancy. Okay, Neil, Liz, Nancy.
Yeah, I found it very disturbing in a useful way, this workshop, and disruptive. And that particularly the dropping everything, the dropping of titles and roles was difficult, and I even felt a bit sick with the wave of anxiety with that.
Yeah.
And then in the group, what came out is and I've thought about it now as I was making some Marmite on toast, about how my life or my family's history has been a history of misfits. There's been lots of displacement, again because of the war and because of the Irish famine, and I married a misfit, so my wife spent all of her childhood growing up in all different countries. She never knows what box to tick on these ethnic profiling forms that I've got to fill out. And so my philosophy, I think, is to provide welcome. And belonging, a sense of belonging. And I was in the breakout room, and I was thinking, well, where do I welcome the clients to? And I think with the clients that I've ended up working with, particularly with autistic clients and a lot of the young people that I work with, they also experience themselves as not fitting in. So I think the welcome has been to a coalition of misfits, and that we don't have to fit in. Wow. And on that same note, working outside, I said, I found challenging because of the lack of containment, not having a place.
Yeah.
And I think it's because it goes against my philosophy of providing a welcome to a destination.
Yes.
And in this place, so I use this room, I can say that this is mine. And I think that's important, to be able to invite a misfit into a place that is contained.
Neil, I feel really moved by your philosophy and how important that is as it emerges. And thank you for letting us have a window in. I really want to be welcomed by you. I think I am, actually. I feel like I am. Yeah, it's good to see you, Neil.
Thank you.
Can we move across to Liz? I assume Liz is the one in the white.
Yeah. Sorry, my dog decided that she wants a piece of the action too.
Excellent. Good.
Yeah. I'm not going to apologise, but I'm going to ask for some understanding, because I'm really aware that I'm kind of really in the process. This has stirred some things up, and
yeah.
I just wanted to sort of reflect that lots of the ends are starting to pull together for me during this workshop. The cultural item that I, in a rather panicked sense, pulled off the shelf was the Oxford English Dictionary.
Oh.
And now that's starting to make sense to me now, because I think central to my philosophy, or part of, I mean, it's a work in progress, as I hope it will always be, is communication.
Right.
And I'm aware that that particular cultural item comes with some really tight boundaries of long words, how things should be spelt, how things should be communicated. So there's really something in there about the philosophy of welcoming good communication that's not only verbal or not only in words, and being mindful to engage in a communication that's validating for clients.
I was thinking, Liz, as well, you know, there's something about inness and outness of the dictionary, isn't there? You know, it's either in or it's out, and of its time, you know. So I feel like I really want to sort of be your witness. Like, we're colleagues here, aren't we, in this workshop? And we want to, it's lovely, you're surrounded by some really senior people that I know. And I'd just like to see them as, you know, almost like angels around you, you know, in this moment, with you making some discoveries, you know. And I look forward to being with you over the coming years and seeing how that manifests, you know.
Thank you. In the last session, I didn't really have much to contribute, and I was just reflecting on what it was feeling like to sort of sit at an edge of a pond and see stuff coming up and just getting a quick glimpse of it and it's disappearing back down. And that's the kind of process that I'm in at the moment. So I'm really grateful
frozen.
For the opportunity to kind of really back up the truck and look at some of these really big stuff that's quite sorry, am I back with you? I just appreciate the opportunity to back up the truck and look at some of these really big stuff. So
thanks, Liz. And then finally at this stage, Nancy, I think we're going up to Nancy.
Sure. Yeah, Liz, goodness, I echo that kind of backing up the truck and having the opportunity to look at this with a completely different lens. I've done a lot of my, if you can, that's my dog snoring, if you can hear some of the strange noise. He's very peaceful, so put him at peace. But a lot of my own work has been about finding my own self-agency. And I have a transgenerational, particularly women in my family history of that, which I really notice, and some quite big characters that have carried their own pain and loss through not having their own self-agency in the past. So there's something for me about my philosophy about helping people to find their own identities and acceptance of self, their own self-agencies. And interestingly, I attract a lot of quite schizoid presentations into my practice. I almost feel like I'm through this, there's something coming up for me, and I'm not even sure if this makes any sense, but it's almost like embodying my own self, like finding out how to embody my own self again, helping others to do that. And something about helping people to separate, but to be in intimate relationship without being in and out, and they're kind of their real choice, which is say emergent, and we change and we grow with every new experience that we have, including this. And I'm writing my CTA psychotherapy exam at the moment, and I would love to use Tudor's model in one of the essays about personal identity and really underpin that. It's really spoken to me. So it's very, very rich.
Sounds like a good section A or B, doesn't it? You know, in there. Thank you, Nancy. I was thinking that if ever you were off sick, I would be the worst locum in the world for your practice, wouldn't I, in terms of these, it's like, you know, these schizoid clients and my sort of histrionic annoyingness bouncing through the door. Be interesting. I loved what you were saying about people discovering their own self-agency. You know what, and again, you know, if we think about that early exercise about what are we doing in this room here,
yeah,
it's, you know, that's what a Nancy is probably doing, that's what she's doing. And that may not speak to others in the room, but it certainly speaks to Nancy.
Yeah.
You know, and this is great, isn't it, when you start thinking about the written exam, because that's exactly where we need to be, don't we? In our own boots, doing our, knowing what we're doing. Yeah. Okay. You have got the PowerPoint available to you, so I'm not going to kill us with death by PowerPoint, but I do want to introduce the final theoretical idea of the afternoon, which is thinking about pluralistic philosophy. I think there's something terribly relieving about pluralism, because what it's given me, and maybe I am too concrete, maybe I am too pragmatic, but it's given me a how-to. Difference and diversity, and more so, you know, oppression and privilege are really important to me, but sometimes I sit there within a situation thinking, what do I do? How do I behaviorally behave in order to evidence that this is important to me? What, you know, how do I translate this into a doing? And for those of us who might struggle with that, I think pluralistic ways of thinking really give us actions, how we can behave. So I'm going to go into the screen share. And that was the exercise that we've just had a go at. Oh yes, before that, I keep on harping on about why this is important for us, because, oh, hang on a minute. There we go. Why is this important? Because we need to become expert in knowing if we have lost ourselves and can we find our way home. And I think there's what I'm thinking about here is two diagrams really. So this one is a diagram about objectification. What we've got at the top is a real client, but they've become occluded. There is a screen in front of them, and the therapist has got to a point of not really relating to the client, but just being in a sort of a transferential relationship with them. And likewise, that's happening the other way around. So we could argue, I mean, this is a very crude diagram, but we could argue that the client objectifies the therapist and the therapist objectifies the client in the intersubjective space. And that means that both of us are not really in the here and now. And so there's a loss of potency, presence, and connection and intimacy by the therapist. And so what we need is the ability to return to reality, which is the actual people rather than the shapes. So we need to be able to sort of move right and be in real contact. So the process of moving from sort of objectification to subjectivity. So the therapist is able to return to the here and now, and they are able to know themselves. They can step out of the transference and regain their skill of spotting the process. And you know, this is terribly idealized, the words in the box underneath, and they're not subjective enough. Sorry, they're not intersubjective enough, maybe the way the descriptions. But what I'm suggesting is, you know, this idea of moving right to a subjective self rather than being an object. Sorry, let's do it in the therapist there. So we've got a rectangular therapist who's stuck in the transference, but then through knowing who they are, they're able to, through supervision and self-reflection and the support of colleagues and going and hugging a tree, they're able to regain their subjectivity. But we've got to know where that right-hand place is. And if we're very, very wobbly, then we don't know where home is. And so this is why I advocate this model, because I think it gives us a sense of our subjectivity and a place to return to. I don't know if Victoria wants to come in on this. I'd appreciate her support, but I think we could think about cultures, and you know, I was thinking particularly where some people are not welcomed to express their subjectivity. They spend a lot of their time culturally maybe in an objective place, and that can make it difficult for them, I imagine, in the training of becoming a therapist, actually, you know, that they need to learn subjectivity. I don't know if that makes any sense, Victoria, or not really.
Yeah, I was just thinking of Anton Hart, and Anton Hart, the American psychoanalyst, talks about the need for, in order to work with difference, and there's always difference, so I guess every aspect of being in the moment in therapy, is that we need to be willing to be radically open and to have non-defended dialogue. And I think there's something about working in the transference, which very much has been relational TA, of working in the transference rather than with it. So in is when it is an objectifying relationship, but with is when you're making sense of the transferential objectification. And I think that actually I have a responsibility as a therapist and as a supervisor and as a trainer to name my intersectional identity and to locate and own my place of privilege and oppression in me, in order to have that dialogue with clients around the power dynamic between us, of course, when the client's ready. But I think otherwise it's just a projection, as you're saying, an objectification on both sides. And of course, it's really, it is that going to the dark night of the soul, because there's something about really, it is vulnerable making. And that's not to say that sometimes clients do not have to see me just as the white woman. Maybe that's the beginning of the therapy. You're the white woman. And that's probably what Moiso talks about the P1 minus. And of course, you know, I have to hold that as I'm part of the oppressive group. However, I think the healing is in really identifying and locating all those different parts of self that are privileged and oppressed.
Yeah, and you've been really saying to us, you know, over today and also in the preceding weeks, about understanding the subjectivity of the other. You know, really understanding the layers of the iceberg of the other, that then we can really start connecting.
Absolutely.
Otherwise, we're stuck in projection, like you're saying.
Absolutely.
Okay, thank you. Sorry to pounce on you. You're such a rich resource in the room. It's a shame to miss you.
Thank you.
So, what I'd like to do then is, with pluralism, I'm just going to look at, let's say, 3 slides in here. So pluralism offers an ethical commitment to valuing diversity, an awareness towards monolithic, all-consuming truths, because of the way that they can suppress individuality and difference. And so what I think is so exciting about beginning to knock on the pluralism door is this deep suspicion towards monolithic truths, which is quite interesting. We start thinking about writing our CTA and making sure that we're at level 7, you know, and maintaining our critique, because, you know, theory is not true, is it? And there's this amazing quote by, I think you pronounce Rescher, is that right? Who knows? Anyway, that's what it's going to be today. So pluralism can be defined as the philosophical belief that any decent question, any complex question, any substantial question has to admit of a variety of plausible but mutually conflicting responses. Or to put that in English, you know, things are fucking complex. Things are fucking complex. And it seems to me that that causes anxiety, doesn't it? And so people get reductionist and they don't attend to privilege and oppression and difference and diversity, because it is inherently, I'm going to come out with it, I don't know if it's true, but you know, today, it's inherently anxiety provoking, because I can't nail it, and it's dynamic, and I have to think about things, and it's demanding of lots of different ways of thinking at the same time, which I think is wonderful. So that I'm not going to stick with these. So there are these 3 pillars that we can talk about, and this is the second to last slide of the day. So I'll just pick 1 or 2 bullets off here before we come to a close. So, you know, pluralism would argue that there is no one right way of conceptualizing a client's problems. There need to be different understandings, and that they're celebrated and useful for different clients at different points of time. A bit like the developmental argument that Mo was proposing earlier on in the workshop. That there is no one right way of practicing therapy. And then we get into this idea, you know, that different clients, but what I'm saying here is that we need to be thinking about us as the oppressor and the oppressed, that different clients of all different cultures and differences and queernesses and whatevernesses need different things at different points. You know, so a good old Petrushka treatment plan, which is a piece of genius in itself, but also isn't a piece of genius, you know. Where is our critique? It demands of us a mature critique. And if I come down, you know, just the idea near the bottom, you know, clients should be involved fully at every stage of their therapeutic process. And we could think about Neil in the room, couldn't we? You know, like the welcoming process. Clients should be welcomed fully at every stage of the therapeutic process. And, you know, the last point there, inviting critique. So what I love about this way of thinking, pluralistic principles, is in a way that they're deliciously disturbing, deliciously critiquing, and I think they really tip us into, they remind me to broaden myself up into thinking about privilege and oppression. And they give me a sort of how-to of how to do it. They give me pillars and things to hold on to, which I find very helpful at my developmental stage of thinking about difference. Just got something in the chat. Let me just pick that up. If it's relevant. Oh, I can't, sorry. New paradigms. Okay, yes. Right, so let's come to a summary slide for the afternoon. I'll leave that one there because that's another 3 circles. Okay, so outcomes from this workshop. My desire, my hope is that above all, we might have had some hint of a sense of our philosophy. Why? Because this is what informs how we think and model things. It's about theory, and it's something about our doing, our practice. I think knowing our philosophy is essential because it helps us to hold on to our subjectivity and to navigate the seas of the transferential matrix. And I think my opinions have changed a little bit on that, actually, having listened to Victoria. I think there's more of a middle ground there somewhere, actually, about being in, being working with, and being outside of. You know, I think it's not quite as binary as I thought about it. Pluralism seems to have a lot of useful things to say to us about how we can pay attention to privilege and oppression in our practice. To me, it offers us a practical gateway in, and it offers a template of helpful behaviors to attend to in our experiment of reducing oppression and in increasing equality and opportunity. So I'm going to stop the share there. There's no more PowerPoint this afternoon. And I invite us together to spend 5 or 6 minutes ending this for ourselves. What would people like to do or say?
I think it's been a great workshop, Andy. I've really appreciated it, and it's been quite timely for me, because there's the sort of issues that I've been thinking about since I started writing my CTA, and I've been recently now passed the exam, and I'm thinking about where I'm going with my practice and with my identity as a therapist. So it's really been quite clarifying for me and really helpful. So.
Oh, thank you. And I noticed that you have a yellow ribbon on there, Liz Jeffries. I know it's from about 6 weeks ago or something like that.
It's about a month ago, yeah.
Yeah, congratulations. Well done.
Oh, well done.
Would anyone else like?
Oh, sorry, interrupted you.
Where are we going? Nancy.
All right, me again. Hello. Yeah. It's just been really impactful, wonderful workshop. I've really taken a lot from this, so thank you. It's been really rich, and I just love your style and how giving you are with the material. And I kind of like, could you do a whole day? There's so much material here. You could do like a day or two's course. But I think it'd be really interesting. It's something that, yeah, I'm definitely going to take more to supervision as well. So I'm highly stimulated. Thank you very much.
Oh, thank you, Nancy. And we all wish you well with your writing process, and wish you for clarity and joy.
Embodied.
Yeah.
Yes, thank you very much. That was, sorry, Nancy, you hadn't finished. Thank you very much. That was really disturbing and inspiring in equal measures. And I think, really thought-provoking. And I've got an essay to write, which is going to help a lot. I'm going to nick some bits, if I may.
Of course you can. Yes.
Thank you.
That's what it's for. Mo, it's been lovely to spend some time with you today, and I've attended one of your workshops whenever it's happened, every historic conference, so I've learned so much from you, and I really appreciate you.
Well, thank you, mutual. And my end comment was going to be, Andy Williams, you walk the talk. Thank you so much. This has been a delightful experience.
Well, thank you. Thanks, Mo. And thank you, Stefan and Denise, for your notes.
Yeah, thank you, Andy. It's been a really rich afternoon. And I've appreciated your attention to process and breaks and us getting up and moving around. It was also good to be put back in the same breakout room with the people that we'd started a conversation with.
I think, we hope they don't drive us nuts, don't we? But I think on a short workshop, I think it's much better to stick with people. I think our biggest triumph this afternoon has been getting your camera to work, don't you think? The best bit of the work.
Thank you for everybody that held my hand through that process. I've no idea what worked, but something did.
Something has.
So, Andy, thank you so much. What a really beautiful and eloquent and moving workshop. And I feel stirred, and I feel, it's just incredible, isn't it? However often we keep meeting this process, how stirred we are.
Yes.
And I had these images of you all the way through, Andy. 1 minute, you're this like beautifully kind of, what's the word? Beautiful soul. And then next minute you're Hannibal Lecter in your description. The next minute, you're kind of like they just had these different images. And I think, of course, that's us, isn't it? That's all of our beings. And what I really appreciate about you is you show your vulnerability as well as your potency, and they go together. And how generous spirited you are. I love your generous spirit and your generous heart.
Thank you, Victoria.
And thank you for having me today.
No, not at all. It's been brilliant. I think, my experience is just, I always, whenever I get near difference and diversity, I feel a little bit of knowledge, which is helpful, and then I feel real frightening gaps that need developmentally filling, and got to keep going on the journey. I've got to keep going on the journey and keep learning. There is so much to learn. Yeah.
And I think, Andy, what I was thinking about, and in response to what you just said, Nancy, about can you do a few days? I had somebody who rang me up at TA East to say, would you like me to do a weekend on diversity? It was early on in TA East Evolving. And I said, are you free every weekend? And they said, sorry. I said, are you free every weekend? Because I think this is every moment of every meeting of theory, of every meeting of process, of every meeting of practice, is we have a responsibility to attend to. And I think what we've done historically in psychotherapy, we've seen it as an add-on. And so I think absolutely, Nancy, let's keep adding on the days. And Andy, yeah, looking forward to more. Thanks,
Vicky. Thanks, Victoria.
It's what I've really appreciated in this, Andy, is how skillfully you've been provocative, and how skillfully you've disturbed me, and I think others as well, because I found it very gentle and kind, rather than it being this like this juggernaut coming at me that I know I'm going to be hit in a minute with something that's going to upset me or disrupt me. It's been a gentle invitation to follow you down a path of thought that I felt that I could pick up or not. So that felt safe at the same time as being challenging. So
lovely, Neil.
Really
thank
skillful.
you. Thank you very much. And I think you out of your theoretical stable, there's going to be, it's going to come the other way too soon. Right, I want to stick to contracts. So thank you very much for spending time with me and each other. And I think we've had a really good teaching and learning group. And I'm going away taught and learning, so brilliant. So may I wish you well and enjoy Saturday evening. And I think it's medals later and things like that. And if you want to be in touch, please do just pick up my email off the PowerPoint. Okay. Bye-bye, everyone.
Thank you. Bye-bye.
Thank you.
Thanks,
everybody. Bye.
Bye.
Hi, Andy.
Andy,
Bye-bye. Go safe.
Thank you, Andy.
Thank you very much.